Imagine feeling trapped in a cycle of anxiety, stress, or overwhelming sadness that weighs you down every single day. It makes even the simplest tasks feel like climbing a mountain. Now, imagine there's a way out, a way to confront and dismantle those feelings bit by bit. That's where talk therapy comes in, and it could be the solution you never knew you needed. What is talk therapy? Talk therapy, also known as psychotherapy, is a powerful tool that helps people untangle thoughts and emotions that may feel too heavy to handle alone. Through talk therapy, you can sit down with a professional, like a psychologist, counselor, or therapist, and simply talk. But it's more than just chatting, it's a structured conversation that leads to real change. In talk therapy, you explore your feelings, behaviors, and past experiences. You might not realize it, but sometimes, your habits or even your thoughts could be feeding your struggles. A therapist helps you break these down, understand them, and ultimately, change them. Why talk therapy works? At its core, talk therapy is about addressing the issues you're dealing with openly and safely. Maybe you're haunted by a difficult past, or maybe you're just feeling stuck and don't know why. In either case, the goal is to help you see things more clearly. Together with a therapist, you'll learn to identify emotional roadblocks, understand how your thoughts influence your behaviors, tackle fears and insecurities, cope with stress and anxiety, move past traumatic experiences. You're not alone. This is a place where you can bring your worries, your fears, your dreams, and even your anger. Talk therapy is a safe space, and what you say is kept strictly confidential. You have the freedom to explore, without judgment, what's really going on inside. Types of talk therapy. There isn't just one way to do talk therapy. Here's a look at some of the most common approaches. 1. Behavioral therapy. This type of therapy focuses on actions. If you're stuck in self-destructive patterns, things like anger issues, addiction, or self-harm, behavioral therapy works on replacing those habits with healthier ones. It's about identifying the behaviors that aren't serving you and making a conscious effort to change them. 2. Cognitive behavioral therapy, CBT. CBT takes it a step further by examining the thoughts behind the behaviors. Ever notice how negative thinking leads to negative actions? That's what CBT targets. It helps you spot those harmful thought patterns and change the way you think, which then changes the way you act. This can be a game changer for people dealing with anxiety, depression, or OCD. 3. Humanistic therapy. This approach is all about finding your true self. Do you feel like there's a gap between the person you are and the person you want to be? Humanistic therapy helps you close that gap by focusing on self-acceptance and living authentically. This approach encourages you to explore your potential and live a life that's in line with your values. 4. Psychodynamic therapy. Ever felt like you don't really understand why you do the things you do? Psychodynamic therapy digs into the unconscious. It looks at your childhood experiences, past traumas, and buried memories. By understanding these deeper elements, you can gain insight into how they're affecting your present and make healthier choices moving forward. 5. Holistic or integrative therapy. Holistic therapy is customized to meet your unique needs. It combines different types of therapies, like a personal toolkit, to address whatever's going on in your life. This way, you get a best of multiple approaches tailored specifically to help you thrive. Is talk therapy right for you? Talk therapy can be transformative, but how do you know if it's right for you? It's simple. If there's something that's impacting your daily life and mental well-being, talk therapy might be worth exploring. This doesn't mean you have to be in crisis. Even if you're feeling just okay, therapy can help you gain clarity, set goals, and understand yourself better. Talk therapy and common conditions. Talk therapy can be particularly helpful for anxiety and panic attacks, depression and mood disorders, trauma and PTSD, addiction and recovery, relationship struggles, self-esteem issues. If you're unsure where to start, remember that a therapist can help guide you. They'll ask about your goals, your experiences, and what you're hoping to get out of therapy. Together, you'll decide on an approach that makes the most sense for you. What happens in a talk therapy session? Each session is unique, But there are some things you can generally expect. In the first few sessions, your therapist might ask about your family's mental health history, any past trauma or significant life events, how you've been handling your day-to-day life, your goals for therapy. This is an open-ended dialogue. You don't have to worry about saying the right thing. Your therapist is there to listen and help guide the conversation in ways that uncover insights about your life and experiences. Some people find that just talking things out feels like a weight lifted, while others may work with a therapist to develop strategies for managing specific symptoms or situations. Therapy and medication, how they work together. While talk therapy is powerful on its own, some people benefit from combining it with medication. Prescription medication can help balance chemicals in the brain that affect mood and behavior, which can make it easier to work through challenging emotions. This is often the case with more severe conditions, such as clinical depression or bipolar disorder. But remember, this is a choice you can make with your therapist or healthcare provider. Taking that first step. Deciding to try talk therapy can feel like a big leap, especially if you're not sure what to expect. It can help to think about what's been weighing on you lately. Have you been feeling stressed, disconnected, or overwhelmed? Is there something from your past that you just can't seem to shake? By taking the first step, you're choosing to invest in yourself and your mental well-being. If you're not sure where to start, here are some questions to consider. What are you hoping to change about your life? Are there patterns you've noticed in your behavior or thoughts that don't feel healthy? What's one thing that you're struggling with the most right now? Finding the right therapist. Therapists, like anyone else, have different personalities and approaches. It's perfectly okay to try a few sessions with someone and realize they're not the best fit. Think of it as finding someone who can really listen and understand you. It might take a couple of tries, but finding the right therapist can make a huge difference in your therapy experience. Conclusion. So, why talk therapy? Because it's about you taking back control. Whether you're struggling with specific issues or just looking to understand yourself better, talk therapy offers a space to unpack the things that weigh you down. With each session, you're working toward a healthier, happier you.